Colds can be very uncomfortable, but they are not dangerous to you. Colds get better on their own without any specific treatment. There are things you can do to treat your symptoms and make you feel more comfortable while your body fights the virus. While some cold and flu medications are not safe for pregnant people, other medications and herbal remedies may help you find relief from your symptoms. When you become pregnant, everything that happens to you can affect not just your body but the fetus too. This can make dealing with being sick more complicated. Before pregnancy, if you got a cold or became sick with the flu, you may have taken an over-the-counter decongestant. Now that you're pregnant, you might wonder whether it's safe. Although medications can relieve your symptoms, some may harm a developing fetus. But treating a cold or flu during pregnancy doesn't have to be a stressful experience, and you can take many medications while pregnant. Home remedies for cold and flu during pregnancy. When you get sick while pregnant, your first step should be to get plenty of rest. Drink a lot of fluids and gargle with warm salt water if you have a sore throat or cough. If your symptoms worsen, you might want to try saline nasal drops and sprays to loosen nasal mucus and soothe inflamed nasal tissue, breathing warm, humid air to help ease congestion. A facial steamer, hot mist vaporizer, or even a hot shower can work, taking chicken soup to help relieve inflammation and soothe congestion, or adding honey or lemon to a warm cup of decaffeinated tea to relieve a sore throat, and using hot and cold packs to alleviate sinus pain. Is it a cold or the flu? The common cold and the flu share many symptoms, such as a cough and runny nose. However, a few differences can help you tell them apart. If your symptoms are generally mild, then you likely have a cold. Also, chills and fatigue are more likely with the flu. Things you can do to reduce your risk. When you're pregnant, your body's immune system becomes weaker to prevent your body from rejecting the fetus. But it also leaves you more vulnerable to viral and bacterial infections. Pregnant people are also more likely than non-pregnant folks their age to have flu complications. These complications may include pneumonia, bronchitis, or sinus infections. Getting a flu vaccination can reduce your risk of infection and complications. Other things you can do to reduce your risk of getting sick include washing your hands often, getting enough sleep, eating a healthy diet, avoiding close contact with sick family or friends, exercising regularly, and reducing stress. When should I call my doctor? Although most colds don't cause problems for a fetus, you should take the flu more seriously. Flu complications increase the risk of premature delivery and birth defects. Get immediate medical help if you experience the following symptoms: dizziness, difficulty breathing, chest pain or pressure, vaginal bleeding, confusion, severe vomiting, high fever that isn't reduced by acetaminophen, or decreased fetal movement. The CDC trusted source recommends treating pregnant people with flu-like symptoms immediately with antiviral medications. Call your doctor's office if you have any questions or you're not sure your symptoms are worrisome. Takeaway: getting sick while pregnant can be particularly unpleasant, and you might wonder whether it's safe to take over-the-counter medications to ease your symptoms. Generally, doctors recommend avoiding medications in the first 12 weeks of pregnancy. If you're currently taking medication for a condition, or it's after 12 weeks, and you want to take something to reduce cold or flu symptoms, it's a good idea to talk with a doctor about what's safe and what you should avoid. That's all my top mamas. Like and subscribe for more of these videos.